Anne-Marie has recently retired from Dorset Healthcare, but I wanted to make this nomination before Anne-Marie's retirement in recognition for her years and years of service, not only to Dorset Healthcare, but the patients of Poole and Dorset as a whole. She has an amazing commitment to care. She never once has ever dropped her standards, what's important to her, and she's invested so much in the training of not only her own staff, but other staff throughout the Trust by supporting the induction and training of bank healthcare support workers. Anne-Marie said to me before she retired that what she wanted to do when she retired was live in her house. She hasn't just moved there, she hasn't just been there, but she's worked so much over the years, she feels that she's not lived in her house. She wants to go home and enjoy that, but she's also joined the Trust Bank, so I'm sure she'll be back.
The thing I enjoyed most about my career is looking after older people and helping them to get back to where they've wanted to be. Most of my career has been at Alderney Hospital on the rehabilitation wards, so that's what I've done most of, and that's the important thing to me.
We nominated Karen and Chantelle because we felt that they had worked over and above their job roles in coping with lots of changes within the Looked After Children's Health team. Their job roles are quite complex. They have to work across organisational boundaries. They have to work across two different locations, Wimborne and Dorchester, communicating with each other all the time. And they've also had to cope with a big increase in staff. And what they've done is worked together to come up with different processes and spreadsheets to enable us to deliver our nursing services more effectively.
When I go home at the end of the day, I know that I've done a good job and the team have done a good job to look after the children. They're just a fantastic group to work with. You never know what you're going to do each day. They're just fun to be with. The team itself has grown since I've started, and it just seems like it's all coming together now.
The work every day is different. You just learn different things on a daily basis, from picking up from making spreadsheets and making new processes, right the way through to making appointments for children to have their initial health assessments or reviews. It was just a privilege to be recognised for the hard work that we've put into the team.
I really wanted to nominate the East, West and North Early Supported Stroke Discharge team for the fantastic work they've been doing with our National Stroke Clinical Audit. They've been doing this for the last 3 years. It requires taking lots of outcome measures and even supplying us with a fantastic report. Their results show that they're above national average for the interventions they do, and they're just a great team.
Stroke services in Dorset Healthcare has been set up so that the intervention is mostly provided by teams in their local area. So we rely quite heavily on input from the community rehab teams, with some specialist supportive care in the 3 sort of regional areas of North, East and West Dorset. We adhere to national guidelines, and we're able to get those results of how well we are providing that service through the Stroke Sentinel National Audit Programme, which has been replied as excellent service. We are performing above average for all the services that we provide.
Working in the stroke team's brilliant. We have a really dedicated team of staff who are really passionate about stroke and understand the difficulties that people live with when they're coming home from hospital after their stroke. And also we're all really aware of the national picture and how things are changing in stroke care, but how we can apply that to our local geography and the people that we work with in the situations that they live in.